Andy, thank you so much for finding the time to meet with me. And congratulations on your new job.
I appreciate it. That's really kind. Thanks. Exciting time.
Oh, it sounds like this. I guess, I should probably start with my Joe Simone question. I ask it entirely too often, which is you've seen one cancer center, you've seen one cancer center. What is Sidney Kimmel Cancer Center? How is it different from others?
Well, I think that the Sidney Kimmel Cancer Center is located right. It's in the heart of Philadelphia, right? And so we serve the communities, in our catchment area, particularly in Philadelphia, are underserved minority communities. The cancer burden is incredibly high. The incidence of mortality rates are extremely high and really exceed that of the state and the national levels. So I think that, being in Philadelphia, recognizing, the cancer burden, understanding the importance that we play to the city of Philadelphia and to our catchment area, and this sort of unique responsibility is really what drives us.
But it's grown quite a bit under, well, your predecessor, Karen, in terms of the territory, just huge expansion. Actually one expansion did not happen, which is the merger with Fox Chase, or the purchase of Fox Chase. How is it different now? What's happening? What's the plan?
Well, so I think that, with enlarging our, catchment area, so now we service 7 counties. And I think that what that does is it creates incredible opportunity for us in terms of these diverse patient populations. And so when we think about strategically how to plan the science at the bench, how we bring that out into the communities, how we now have a much broader playing field in which to learn from, so that there is this bi-directional communication between the bench, the bedside, the community, and back to the bench. So it's created this, really incredible opportunity to do, transformative science.
Well, you're doing a lot of collaborations with community centers too, right?
That is correct. And as part of that, we want to ensure that regardless of where a patient touches a Sidney Kimmel Cancer Center, that they are receiving the highest quality, safest cancer care, and that they have access to all of the resources that the Cancer Center has available. So the integral hub, remains in Center City, and this is where, the basic and translational scientists live, and we're able to bring that work into these community sites through these advanced care hubs, where we have set up clinical trial portfolios to match the patients that are within that particular region, so that we're able to actually deliver on that promise of the highest quality, cutting edge care, regardless of where somebody enters our front door.
You were appointed center director 14 months before deadline for CCSG submission, which is
that is correct. Correct.
Yeah. How is it going?
Well, so I think that this is an incredibly exciting time, for me. I mean, this is, we've done a number, of things. The first was that I was able to secure the largest director's package in the history of the Sidney Kimmel Cancer Center. So that was really important. The second was that, and what I took on immediately as the permanent director was to really create the vision and the strategic plan for the next 5 years, which we have termed as Impact PHL. And the PHL, as you'll recognize, is the acronym for the airport. And so meaning that this is really, meant to the work is meant to encompass the communities that we serve, and clearly that the airport, serves. I mean, I think that the other thing that was really apparent very early on was because of the changes in the FOA for the CCSG, with regards to consortium arrangements, that was really important to me to very quickly transform that consortium relationship with Drexel University, which we've been able to do. And now I think, have really, a much deeper relationship that will foster bidirectional recruitments, multi-PI grants, publications across the universities. And it's really tying the universities together, I think, in a very nice way. So that's really been, on the forefront. I mean, the other thing that was really important to me, Paul, was to make sure that I created really a highly engaged staff that really see transparency, that they really feel a part of what we're doing. That was important to me when we created the strategic plan, because we interviewed over 60 people in the center as I was putting the strategic plan together, because I wanted to really make sure that people were highly engaged in the process. So that was, pretty important. I think other things, I mean, I've had tremendous support from leadership, right? Leadership in the health system, both at TJU, at Jefferson Health, and at Drexel. I continue to report to the CEO of the health system, and have really, I think that, very close working relationships now with the president of the university and the president of the health system, as well as the report, to the CEO. So that's been, really important. I guess the other thing that I've been thinking a lot about, and has really been important to me, is fostering an environment where team science is what we do every day, and fostering the development of those teams across basic science, population science, and the physician scientist. And so in every disease lane. And so, thinking about, I've transformed sort of the recruitment process so that we have the emphasis is on physician scientists to help meet that need of team science, and looking to continue in terms of those strategic recruits, specifically with a clear eye on building, where do we need those team science groups built. So that's been, I think that's been pretty exciting. It's really been important. The other piece, I guess, is that, COVID, hurt us, a bit with regards to the clinical trial enrollment. We never stopped. We never closed anything down, but I think just, there was some, I think difficulty, with patients, coming to centers, for trial enrollment. And I think that we put a number of measures in place to rebound, those clinical, that piece, And that's been pretty exciting too, because again, that's really important for us to deliver on, is the cutting edge science in the form of clinical trials for all the patients that, that we touch.
Well,
So
actually, I'm wondering if the strategic plan was the first thing you did when you came in, right?
correct.
How long did
Correct.
that take? How much of a strategic plan was it? Is it anything? What's in it? What's the
Yeah, so it was literally, I mean, it was a crash course in that, we had to really do this over a 6-month period of time, and it is a completely, um formulated, new strategic plan for the 5 years.
wow, wow, and it's different from what was done before.
Correct.
And that if you were to just say what's the most important aspect of it, what would it be?
Well, I think that you sort of touched upon that at the beginning, and that is, looking at, our catchment area and the disparities, that we have in terms of the patient population that we serve, key underpinning centers around really addressing that, how we address that cancer burden through the lens of the health disparities that we have within our catchment area. That's one key piece. I think the other piece that layered on, and probably not surprising to you, is the incorporation of research that specifically speaks to the aging and cancer interface.
Oh, let's get to that. Let's save that one. I would love to hear more, but let's just save it for the next. I just had a couple of more follow-ups to what you
Sure,
said.
sure.
You mentioned that you have the largest dowry in history of Thomas Jefferson Cancer Center, or Sidney Kimmel Cancer Center. Can you tell me more about the dowry?
Well, so I think that, it's sort of, I'll go back to the importance of recruitment of, physician scientists, basic scientists, population scientists, to really enhance that team-based science approach, is going to be, a key component. There's also, not surprisingly, funds. We've built a significant amount of infrastructure since I've taken over, in terms of the research infrastructure, research administration infrastructure, the CRO. So, I mean, there were important pieces of the center that really needed enhancement. So that's going to be, an important piece that we've put in place. I mean, that was early on recognized that, that there were, key recruits, not only in terms of faculty, but in terms of administrative recruits, data scientists, things that were really going to be important, to enhance the center's capabilities.
So have you already made the recruitments, or are you still recruiting? So
We continue to recruit,
large numbers of people.
vigorously. So in terms of faculty, yeah, I mean, so we've had, there are very high level recruits. And I think that, that I'm really, very proud of, and I think will, be quite important, for us going forward. And there's other, folks in the, that are in the going through the phases, in terms of, of contracting and so on and so forth.
So there's more. There's more.
Oh, there's more. Yeah, there's, active faculty recruitment will be ongoing for, years to come.
And this is so you have the money to do it.
That's correct. This package will really support that.
Oh, fantastic. And you also mentioned the consortium with Drexel.
Yes.
Is that the 5 and 7 rule that you had to satisfy that you couldn't before, or are you still?
So interestingly, no. So interestingly, they have the number of scientists with R01s. So it wasn't an issue specifically of in terms of the number of scientists or the grants that they held. It was much more that the FOA has really, changed with regards to deepening the relationship. And so that there is, financial commitment in the consortium there. We've built out, now a working group to really enhance the integration of all aspects of the consortium, so that there is greater connectivity across Drexel and TJU for developing projects, science grants, multi-PI grants, papers. There's an oversight committee that is looking at the deliverables, which we've set metrics for the consortium to be productive. So it's a much deeper relationship. We've had a good relationship with Drexel for since 2013. And this has just taken that and enhanced it and really built it, and made it even stronger. We've had Drexel faculty serve in leadership positions within the Cancer Center. We're enhancing that, as part of the consortium, realignment. So I think it was really meant to just deepen, the working relationships for the scientists in both universities.
Oh, fascinating. Are you applying for comprehensive designation?
We will apply for comprehensive designation, yes.
Oh, fantastic. Because last time around, I think the problem was the population sciences were not mature enough, or at least that's what I think was said. I don't know. Yeah, am I wrong, or have you fixed that?
I think that what we did was we took the feedback, we took the information from the submission, which basically spoke to the need for for bolstering population science. And what we did was we actually developed a program of excellence called Cancer Risk and Control, in which population science is the largest component. And then so that was one piece. We also shifted the programs of excellence away from disease-based programs to programs that are molecularly based programs, things along these lines. So in doing that, it will enable the population scientists in the setting of, as I said before, team-based science, to work with members of all of the other 3 programs of excellence. But again, the development of cancer risk and control was, I think, a direct response to the need to strengthen the population science footprint.
Yeah, and you didn't just parachute in, you were involved in all of this all
Correct.
along, right, with Karen.
Correct.
You were working on all of these issues, so it's kind of continuity, right?
That is correct. Yes.
Yeah, that's kind of an important point here. And
So I spent the I think it was almost 5 years as the chief of cancer services. And so we worked, hand in hand, on almost a daily basis. And so, so that the continuity, has been there. That is correct. The Jefferson Health Sidney Kimmel Cancer Center passion really comes from my being reminded by my wife that I've had exactly one job, meaning that I've been here my entire career, Paul. I never left. When I finished my fellowship at Fox Chase in 1994, I came to Jefferson, and Jefferson and Health and the Sidney Kimmel Cancer Center has enabled me to build my entire career. I mean, this has been, I've had developed great, colleagues, and just, it's been a pleasure, and it's been an honor, to work here and to come to work every day, because this has been my entire life. So
That's I'm just that's fascinating. I was going to actually ask you about some of the history of this, because I think that geriatric oncology, is the father of it is B.J. Kennedy, right?
that is correct.
Was he ever a cancer center director?
No, I do
Okay.
not believe so.
Okay.
Yeah, I think you should, verify that, but I don't think so.
I think you are the first cancer center director who is focused on geriatric oncology. You
That
might.
is true.
What does that mean to in terms of project programs, in terms of focus of?
As I was looking at, models of care delivery to just try and improve quality and safety, it became apparent to me that older adults were arguably the most vulnerable population, and they were the ones that were at the highest risk for falling through the cracks of a fragmented healthcare system. They didn't have great access. The healthcare system really wasn't supportive, of their specific needs. And so, this created sort of, for me, this passion about how are we going to address scientifically meeting the needs of older adults, whether it is access to clinical trials because they were excluded from clinical trials because of an age restriction for decades. If you were over 70, you couldn't enroll. How could we address access to care? I mean, a multitude of things, and we could talk about this for hours. But I think the key point there was that it created, this sense of that I need to do something about this. And I very early on got connected with basically the leaders in this country, in geriatric oncology, two of which were actually mentors to me. One is Lodovico Balducci, who used to be at Moffitt, and was a dear friend and tremendous mentor for me. And the other was Arti Hurria, from the City of Hope. And we know that it was unfortunately very, sad and untimely passing. But I sort of joined the Cancer and Aging Research Group that Arti headed up very early on in the development of that group. And we became, very good friends. She was incredibly important in helping me to develop the multidisciplinary evaluation center that we call the Senior Adult Oncology Center at Jefferson. And so we really, became, really strong friends. And, honestly, I mean, I made a promise to her, early on. And I said, if anyone ever hands me, a microphone, I'm going to get up on the rooftop and I'm going to advocate for older adults any chance I get, because this is important. And so, I've really carried that, through and continue to deliver anytime I can, on that promise, because it's really important. And so that passion really developed around that understanding of what was coming, again, what we call the silver oncologic tsunami, that this was really going to be important. And so that's been the research platform, and now being given the opportunity as a director is to build aging and cancer research across all of our programs of excellence across the universities, and really inject this in so that not only does it afford us the opportunities, but also raises the awareness and the what we talked about before with regards to disparities. So that was really key. The honor of being the first director who is focused on geriatric oncology. And what it means is that, what I really want to do, is to help researchers and clinical investigators to really understand, what are the unique and really nuanced issues of aging and cancer, and hope to be a strong center director who's going to advocate, for this, really for conducting research across the scientific spectrum, and raise, I guess, this awareness for all the centers to view aging as a factor for cancer incidence and mortality. But one of the things that I continue to harp on is that aging needs to be viewed as a disparity. It's actually a disparity that cuts across, and so the awareness that aging is a disparity and we have to address this disparity. I will tell you that the demographics, in this country as well as globally, for the aging population, because cancer is a disease associated with aging, because the incidence, increases with age. So not only is it the number of patients who will be afflicted by cancer over the age of 65, but it's also the number of survivors that are going to be over the age of 65. Requires, intensive study, and there's a lot of work to be done here. We've written about this in the past. We termed this the silver oncologic tsunami, a basic tidal wave of things that need to be done for this population. So, what I'm doing is building an integrated center that's really meant to address the research around cancer and aging and care delivery, as well as the supportive services. And we have, real strength in this at both TJU and at Drexel. And so the intention is really, we want to make paradigm shifting discoveries, and then significant impact in terms of the delivery system that will really meet the needs of older adults with cancer. And I think that there has been appropriately, and with my predecessors, there's been appropriate attention, very importantly, to race and to ethnicity, right, in terms of disparities, and my hope is that this is going to now I can shed the light on aging, and that really leads to the design of trials, clinical trials, or care delivery models that are really going to be inclusive of older adults, and really, focus on, why they are different. So.
Oh, this is something we should really focus on at the cancer letter as well. So we should really cover this more closely, and please keep us in the loop on that. Yep. Also, we were talking about COVID when I rudely interrupted. How is the recovery going from COVID, and how were you affected?
So I think that, there's a couple of points to be made. So the recovery has gone very well. Let me say that. We were in a unique position because the leadership at Jefferson Health had already invested heavily in telemedicine years before COVID. So in the clinical space, the ability to shift to telemedicine and continue the care uninterruptedly was, I think, seamless. We never closed our infusion centers. We never missed treatments, based upon care delivery. So I think that continued. I think we pivoted very, very quickly in the clinical research space. And so, I think that we were able to, as I said, keep the clinical trials office open, continue to enroll patients. I think there was some hesitancy on the part of patients to come in, and in other than if they needed treatment. And so on that basis, I think that hurt not only SKCC, but centers across the country in terms of clinical trial enrollment and of course screening, which a lot has been written about. I think that and so we made the necessary moves. I think that we've launched a mobile screening unit, that goes through all of the communities that we serve, the goal of which is to bring education and screening, into these underserved communities in efforts to really rebound, as you point out, from the effects of COVID. So that's been really important in terms of our community outreach, and it's been a phenomenal touch point for patients to not only get screened, but also to receive educational materials or to just get connected to healthcare, because we have our electronic health record on the mobile screening unit. And when patients come for a screening, if they don't have a primary care doctor, we connect them with a primary care doctor at Jefferson Health. So it's really been I think a huge, huge win. The thing that I found, I'll touch back to the older adult. The thing that I found that was very distressing was the social isolation and the impact that had, particularly on vulnerable populations, and older adults being particularly, vulnerable because many would live alone and may not have digital literacy capabilities and things along those lines. So I think that we spent a lot of time around this. We put together task forces and really tried to close that piece. So the long-winded answer is, things have bounced back very well, but it was through a lot of hard work and a lot of effort from some very smart people, throughout the cancer center.
What's financially, how badly was Jefferson hit by COVID?
Yeah, so I think that, nationally, we know that health systems, across the board, not across the board suffered, and there was certainly support, governmental support to help limit, those losses. We had losses for sure, like the other health systems. However, what I will tell you is that the health system is incredibly strong. When we look at the financials, for the health system, I believe that, and what is clear is that the health system has done remarkably well, through this. That doesn't mean that we didn't have shortfalls, because we did, but comparatively speaking, we've really performed in the top 10%, nationally on a financial, from a financial basis. And so the health system, I think, is emerging from this in actually in a very strong place.
What about clinical trials enrollment? Are you doing okay on that?
Yeah, so I think that as I mentioned before, that was really an important, call to arms, from me, because not only did we have the piece around COVID, but I think you're probably also aware about the staffing turnovers in the CROs across the country. And we've had that issue. I serve on the task force that AACI has put together to address CTO retention, for staff. And so, we, along with all of the other, cancer centers nationwide, have felt the effects of the turnover, and so as a result, I think that it was important for us to, put in place both short-term, and long-term tactics to address clinical trial accrual. And that starts, frankly, with, very deep engagement, with all of the members of the CRO, all of the faculty, and the leadership, and really knowing that, this is one of, if not our highest priority. And so,
are you back to where you were, or are you?
We are. Yes. So the numbers continue to climb, and I'm happy to report that things are much better, but right, we still have the potential, long-term issues related to staff turnover in the CRO that need to be corrected. And that's not a Jefferson Health SKCC issue. That is a national issue that the NCI, the AACI, across the board, we are all actively engaged in correcting, because long term, we don't want, obviously, the clinical trial accrual to suffer and be put at risk.
No, absolutely. What was your biggest surprise as a new director?
My biggest surprise. I think that, just how incredibly, interesting and exciting, the role of director is, right? I mean, I want to say I was once removed, I was working, but I wasn't at the helm, right? And so when the reins are in your hand, and you're really, deeply embedded in every aspect, every function, it's really a very, interesting and exciting, opportunity. One that I, at least, years ago didn't expect. And so being given this opportunity is really phenomenal. And, it's enabled me to really understand the complexities, of the Cancer Center, which is fascinating and exciting. I will tell you that I have become what I consider a student of the funding opportunity announcement. So I have read through the FOA at currently, I think I'm on the 8th run through. I believe that by the time we submit, I will have read the FOA in detail probably 20 times. We're going to submit in May of 2023. So I see this as, it's been an incredibly exciting opportunity. I think that there's pieces that I was not, involved in before, things like being at the helm of driving philanthropy for the Cancer Center, for example. And that's really been fascinating, and really, I was always involved in philanthropy across the board, but really driving it as the leader, of the Cancer Center is a different place. And that sort of speaks to each of those functions of the director, that really, having that the reins is really, it's fun, it's exciting, and I didn't know exactly what to expect or how I was going to totally feel, but I can tell you that it's pretty awesome.
Are you having fun with that aspect of it, the fundraising and so forth?
Yeah, I think it's very important. I think it's, the government relations, the fundraising, all of it, I think is really, it's really, advocating. We talked about the, the clinical research organization and CRO and the staffing. I mean, all of these pieces are really, they're things that they're just exciting, and it's fun.
Oh, fascinating. So the submission is less than a year away. That's
it is, in fact.
How is it going? You're getting any sleep?
Well, so that's a great question, right? I sleep very well, Paul. Okay. Honestly, I sleep very well. I sleep very well because, and I'll say it this way, I am incredibly proud of the work that is being done in this Cancer Center. And I think that drives, my thinking around this. I think I have the honor of working with highly engaged, highly motivated, very talented people. And I think that when I really enjoy coming to work. And by the way, I come to work every day, meaning I come into work every day. Regardless of whether I have Zoom meetings, I like being here. I like connecting with my team. I have an incredibly strong team that is very tightly knit. And I think that that it's made it really, really nice for me. So that being said, I believe that we're going to have an amazing submission, and that's what we're going to do. And I think that all the members of my team believe that. We are actively engaged in the writing, and I think that it's going to be awesome.
And it's the same team, right? The team is exactly the senior leadership team is same as Karen's.
Not exactly. Not exactly. There are several members, but there was sort of role delineations that that needed to be done. So there was some shifting. There was also, we moved to a single deputy director model. So there have been changes in terms of the organizational capabilities. There were things I had to reformat the EAB membership, develop internal advisory boards. So there has been some, I would say some significant structural changes. Several of the people, however, that you have pointed out, are here that were here previously. We haven't had turnover in that respect. So there were people, and they weren't all in leadership positions, but and so we have made some changes from that standpoint. But the team, I guess the long-winded answer is the team remains intact. Yes.
That was my question. Yep.
Yeah.
Yeah. Well, that's fascinating. So when you're not focused on being a cancer center director, what do you do?
What do I do?
Yeah.
Well, I think that, high priority on family time. And so that, that is, spending time with, I have three kids. One who you met is in Chicago, one is in Boston, and one is in Philadelphia. So spending time with them and my wife, high priority there. We go to a fair number of the arts, whether it's concerts or plays. So music important. We spend a lot of time on long walks throughout Philadelphia. We would sort of pride ourselves on knowing every street and have walked down every street in Philadelphia. I spend a fair amount of time, I guess. Stress reduction comes in the form of activities like running or cycling, tennis. So those would be those would be high on the list. And then sometime recreational reading. We also have a house at the beach, so we spend a lot of time there in the summer and periodically in the winter, because it's only an hour away. And we're getting back to traveling, right? I mean, now that we've been able to to travel again, that's becoming a priority as well, because that's something we've always enjoyed.
Yeah, it's great. Is there anything we've missed? Anything I forgot to ask?
Well, I think we've done pretty well. No, I think we've done pretty well. I think that the things that are really important to resonate is the importance that the Sidney Kimmel Cancer Center plays to delivering on the promise to the citizens of Philadelphia and the communities that we serve, that we're going to reduce the cancer burden and try to eliminate what as best we can. And I think that that's really an important thing to resonate for us, because we're working very hard with very bright people in a part of the country where the morbidity, mortality incidents are really high. And so I feel very responsible for that. We must deliver, and we will deliver.
Thank you very much.